Hi, my name is Cristian Suarez, and now I am going to talk about Sofosbuvir and Ribavirin in hepatitis C virus genotypes 2 and 3. Definition: hepatitis is the inflammation of the liver. Hepatitis C is caused by the hepatitis C virus or HCV. Hepatitis C is spread from contact with the blood of someone who has the virus. About the ways of transmission, the contact with the blood of someone who has the virus can be through many ways. For example, being tattooed or pierced with tools or inks that were not sterilized after being used on someone who has the virus. Having contact with the blood or open wounds of someone who has the virus. Also, the infection can happen through uncontrolled blood transfusions. Sharing needles or other drug supplies or accidentally sticking with a needle used by someone who has the virus. Sharing personal care items that may have come in contact with someone else's blood. Having unprotected sex with someone who has the virus, and being born to a mother with hepatitis C virus. About symptoms, most people with hepatitis C don't have them. Some people with acute hepatitis C have symptoms 1 to 3 months after being exposed to the virus. The symptoms can include dark yellow urine, fatigue, fever, clay or gray colored stools, articulations pain, loss of appetite, nausea and vomiting, abdominal pain, and jaundice. This disease can be acute or chronic. On acute hepatitis C, the infection usually where the symptoms can last up to 6 months. Sometimes the body is able to fight the infection and the virus goes away, but for most people, an acute infection leads to a chronic infection. Chronic hepatitis C is a long-lasting infection, and if left untreated, it can last a lifetime and cause serious problems such as liver damage, cirrhosis, liver cancer, and even death. In chronic hepatitis C, symptoms may not appear until it causes complications. This can happen decades after the infection. There are 6 main genotypes of the hepatitis C virus. Genotype 1 is more common than genotypes 2, 3, 4, 5, and 6.
Hepatitis C is a major problem in the United States and really around the world.
More people are dying of hepatitis C in this country than of HIV.
I think many people don't hear about what hepatitis C even is and how you can get it.
So hepatitis C is just a virus. It doesn't do a whole lot other than want to live in your liver and make more copies of itself. So the word hepatitis has to do with hepa, which is the liver, anything having to do with the liver, itis, which means irritated or diseased. And we know that there are different viruses that once they're in the body, their home base is the liver. The primary viruses we see in this country are hepatitis A, hepatitis B, and hepatitis C.
So anytime someone was exposed to someone else's blood, and that could happen through blood transfusions before 92, organ transplantation before screening, people on dialysis, people with hemophilia, as well as people who inject drugs. All were identified as high-risk populations, as were people living with HIV, because many of the same modes of transmission for HIV are also true for hepatitis C. Their immune system tries to fight it, and this battle goes on in a very silent way in their liver for 10, 20, 30, 40 years. And it may also be causing other problems. Hepatitis C is linked to things like the development of type 2 diabetes, as well as lymphomas and kidney disease. But what happens to some people is over time their livers scar, leading to cirrhosis. But it's only at that stage, when the liver can no longer function, that symptoms become obvious.
When you're having all that itching, that's because your liver was acting up.
I had no symptoms. It didn't affect anything that I was doing. So I didn't respond to it.
And once you get cirrhosis, your liver can stop working.
And the idea is, if you don't know you have it, you can't get the treatment and you can't be cured.
Medical application. Of the 6 major genotypes of the hepatitis C virus, genotypes 2 and 3 account for around 30% of chronic infections worldwide. In clinical trials, treatment with a combination of the nucleotide polymerase inhibitor Sofosbuvir and the antiviral drug Ribavirin was associated with high response rate among patients with hepatitis C virus genotypes 2 infection, with lower response rates among patients with hepatitis C virus genotype 3 infection. Ribavirin is a molecule with antiviral activity on different viruses. It has found its place in clinical practice almost exclusively for the treatment of the hepatitis C virus. Sofosbuvir is an oral nucleotide analog inhibitor of the HCV-NS5B polymerase that is effective against hepatitis C virus genotype 2 and 3 when it is administered in combination with ribavirin. It works by decreasing the amount of the hepatitis C virus in the body. Its presentation is in tablets or granulates to take orally. It is usually taken once a day with or without food. Pros and cons. Pros. Patients receiving sofosbuvir and ribavirin had substantial reductions in circulating hepatitis C virus RNA levels during the first weeks of the treatment. Sofosbuvir dramatically improves cure chances for the hepatitis C patients. Sofosbuvir and ribavirin treatment is an effective and safe rescue therapy, but drugs have a relatively rate of serious adverse events. Cons. Sofosbuvir requires other medications in addition to ribavirin, such as vilpatasvir, edipasvir, or daclatasvir. Ribavirin will not treat hepatitis C unless it is taken with another medicine. Ribavirin can cause anemia, which can make any heart problems worse and can lead to a heart attack. In pregnancy, ribavirin can cause injury or death of the fetus. Patients with liver cirrhosis and hepatitis C virus genotype 3 remain the most difficult group to treat. Issue applied in Ecuador. According to the news item published by the newspaper El Telégrafo, the main problem in treating hepatitis C is its price, which is around $84,000 for a 12-week treatment. According to the pathologist Javier Mora from the Luis Bernaza Hospital in Guayaquil in 2017, it is difficult to detect hepatitis C early because it doesn't manifest itself with a clear clinical picture. According to him, 90% do not know they acquired the disease. Conclusion. Hepatitis C is a liver disease caused by the hepatitis C virus. This virus can cause acute or chronic hepatitis, the severity of which range from a mild illness that lasts a few weeks to a serious illness for life. Hepatitis C is a major cause of liver cancer. Antivirals can cure more than 95% of hepatitis C cases, reducing the risk of the death from liver cancer and cirrhosis, but access to diagnosis and treatment is limited. Currently, there is no vaccine against hepatitis C, but there are preventive measures such as the appropriate and safe use of injections and the safe handling and disposal of syrups. Treatment with sofosbuvir ribavirin for 12 weeks in patients with genotype 2 hepatitis C virus infection and for 24 weeks in patients with genotype 3 infection result in high rate sustained virological response.
You've had a blood test called a hepatitis C antibody test, and the test has come back positive. This means the test found hepatitis C antibodies in your blood. At some point, you've come in contact with the hepatitis C virus. Hepatitis C is a virus that lives in the blood and can have serious effects on your liver, even causing cancer. Around 1/4 of people clear the hepatitis C virus on their own. Unfortunately, even if they do fight it off naturally, they can get it again if they put themselves at risk. There is no immunity to hepatitis C and no guarantee of being able to clear it a second time. Your doctor or health worker will have to do another test to see if you have the hepatitis C virus. This is called a PCR RNA test. If this test is positive, it means that you have the hepatitis C virus, and without treatment, it will be there for life. They will also discuss with you about when you think you may have contracted the virus.
So what will happen to me?
Most people living with hepatitis C don't feel sick for a long time, but slowly, over many years, they may get tired, run down, and unwell. This can make life a lot harder to live, and sometimes is very serious, even deadly. The good news is there's now a very effective cure that you can get from your doctor. There are new treatments to cure hepatitis C, and around 95% of people on treatment will be cured. Just be aware, even if you clear it or it's cured, you can still take it again.
What is the treatment?
For most people, all it takes is one pill a day for 8 to 12 weeks and a few simple blood tests along the way. It's very important that you take your treatment every day until you complete the course. Unlike previous treatments, there are very few side effects. During treatment, your doctor or healthcare worker will do a blood test to see how you're going and if it seems to be working. After 8 to 12 weeks, you'll have finished your medication and you'll have another test which we hope will confirm your hepatitis C is gone. The doctor will want to see you again a few months after taking your last tablet. There will be another test called an SVR test. This is the most important blood test as this is the one that tells us if you're cured. But remember, this is a cure, not a vaccination, so you can get hepatitis C again if you put yourself at risk. If you become reinfected, that does not exclude you from further treatment.
How do you get hepatitis C?
Hepatitis C is only passed on through blood-to-blood contact. Most everyday activities do not pass blood from one person to another. Just living, working and being around people who have it is not a risk. The most common way of passing on blood is by sharing any equipment used for injecting drugs. And you can get it from using unsterilized tattoo and body piercing equipment, or sharing razors and toothbrushes and ceremonial tools. So basically anything that passes infected blood from